Hi, everybody. Good morning. This title is not mine, right? It came from this course development. How many of you have to order or use cell-free DNA testing? That's what we're going to talk about for an hour. Okay. Well, for those of you who do, I think there's some insights that I think will be really helpful today. For those of you who don't, I think you'll learn something. Okay, so here are the objectives for today. And the only conflict of interest I have is that I have a research project that I'm doing with Progenity Labs, which is a cell-free DNA company. And they donated their technical expertise to my project. So for a lot of the topics today, I wanted to just use my favorite definition of screening, which was written by Nick Wald a long time ago, where he said that the definition for prenatal screening among apparently normal pregnancies of those at sufficient risk of a specific fetal disorder to justify subsequent invasive and or costly prenatal diagnostic procedures. So really what this says is that prenatal screening is different than other kinds of screening. You're taking a normal, healthy woman and you're trying to find out if her baby has a genetic disorder. And that's a little different than normal screening for women, you know, where we screen them directly for glucose testing maybe, or pap smears for cervical cancer. We're screening women for their babies. So just a little bit of background. In 2007, the American College of OBGYN said all women should be offered all forms of diagnostic testing and screening. And really what they mean to say here is that it's paternalistic to say, you're 35, we're going to offer you a diagnostic test like amniocentesis. You're under 35, you get a screening test. These guys said that's kind of paternalistic. Everybody has a right to any test. And most insurers will cover, actually, any genetic test. So we'll talk about that with its application to cell-free DNA in a few minutes. Just basically the differences between testing and screening, of course, is that diagnostic testing gives you a definitive answer, a yes or no of what's going on with your baby. Screening really lumps women into a high or a low risk category and doesn't give you a definitive answer, but it's usually not very costly and low risk to the woman. And so we use cell-free DNA screening the majority of times for aneuploidy screening. And to just cone down the aneuploidy box is to say that aneuploidy isn't related to your race or your ethnicity, that the general incidence of an aneuploid pregnancy is about 1 in 150 births, and that aneuploidy is due to meiotic non-disjunction. That is, during conception, an extra whole chromosome is in the cell, and so the baby has an extra chromosome. And when that happens, hundreds of genes are added to the fetus, which usually results in a non-viable pregnancy, sometimes results in a viable pregnancy, most often miscarriage or stillbirth. There's lots of ways to screen for aneuploidy during pregnancy. Age, ultrasound, blood tests like quad screens or integrated sequential screening, nuchal translucency screening with or without serum markers, and of course cell-free DNA testing.